Hello, this is Calvin. Today I want to present to you hospital management system. Uh, so first and foremost, we need to log in. Remember, this one is multi-user. So let me log in as a user. So right now, I want to log in as an admin. So fab 1234. So we can log in. You can see we are being welcomed to the homepage, and you are told enter your email to log into your dashboard, right? So we'll be able to put the email here so that we are able to be logged into our dashboard, right? Remember, I've logged in as admin because the role was assigned to this particular user. The role is admin, right? So here we are putting the email, okay? Then we submit. So welcome admin. You can see already our role is being captured here. You have full access. Welcome admin, you have full access. So it means the admin will have access to every corner of this particular software. So this is the admin dashboard, right? Up here you can see welcome Tom Fab, that's the name of the admin, and then the role is being highlighted here, admin, right? So this is the dashboard. So on the far on the far left you can see some captions. These are links to those particular modules, and then these are just icons. They can also act as links. And you can see we have numbers. We are showing numbers below those particular icons. So here we have departments. So as in an hospital, we need to have departments. So here you will be adding departments. So the admin will be adding departments here. So you have department ID, department description, head of the department, and location. All right. So for example, let me just, you see when I click this one, all the details of that particular department come here. So like medicine is a department, right? Description headed by a physician. Head of department is given here. Then the location is block A. Then that particular record was created on 25th November 2023, and then the update was done on 28th November 2023. So actually you can update this one. You can enter new data, right? You can enter new data. You can also update the already existing data. You can update here. So just click this one here. Then you can change whatever you want to change. Then after changing, you simply update. You click update, right? So let me close this. You can also delete. You can select any particular department here. Okay, you can select any department you want. Then after selecting, you can also delete. Alternatively, you can also put the department ID here, like for example ID 9. Then you just search. Then you can either edit, or if you like you can delete, right? Are you sure you want to delete this department? Yes, then you just delete. Okay, that's how you will be managing departments. So let us close this. So you can also add doctors, because in a hospital there have to be doctors. We have to have doctors. There has to be doctors, all right? So this one you have to add the doctors. Here we have the doctor ID, the next one. The doctor IDs are auto-generated, right? So you can add the new ones. So just put the name here, okay? You just put the name, gender, you select from here, the phone number, you will write it here, okay? Then qualification, you will put here other undergraduate degree, master's degree, PhD. All right, the department, the doctor can be in maybe pediatrics or neurology or urology or pathology, whichever department the doctor is supposed to be falling in, you just put there. Then the date the doctor will join the department, you just select the date here, then put everything in order. Okay, right. So you can also edit already existing data. You edit by just coming here, change the details. Right. You can also delete already existing data if you like. So that is how you will manage the doctor's details. The word details, you because in an hospital there has to be words, right? So the ward ID, ward name, type, capacity, right? So you put the ward name here, then you put the type, whether it's maternity ward, pediatric ward, ICU ward, medical ward, whichever type you want to add, just add. Then capacity you put there. Then occupancy at that particular moment you put here. Then the location where the ward is you put here. Then the head nurse, you can also add the head nurse, you put it, you select, then you put there. So it's already data which already there. You can see them here. Okay, so you can add as many as possible depending on that hospital. Then you can edit, you select here, you edit the data. You can also delete the data, right? These are the dates when the record was created and when it was last updated, all right? So you close that one. The same thing you will do to nurses. You will add nurses, right? You can edit them, you can delete, all right? You can also add other staff. So other staff, we can have pathologist, right? Even radiologist. Can also add cashier. Can also add pharmacist and so on. So this way you will add them. All right. These are already added ones. You can select. You can edit. Just the same way. Okay. You can also delete if you want. Okay. So that is other stuff. Then patients. Patients, we can register them. All right. You will actually register a patient. When a patient comes to your hospital, they have to be registered. Right now we have 111, so the 112 of the next one. So just register your patient, right? Okay. So you put the name, date of birth, gender. So you name like that. Date of birth, you come here, you select. Okay. Gender, you select. Emergency contact, you can put the contact here. Then the service name. Okay, because you are doing admission at this point, there's no service, but you can just say registration card. The service cost will be 150. Insurance, is the patient going to be covered? So you can select the insurance here, or you can select from here. Just select. As well, you can add the insurance using this button here. You can just add if you want to add another one. Just add. Okay. Then the status, just say active, right? Then you save. All right. So that's how you will be adding patients. Okay. These are already added ones. You can always edit. You can delete. Okay. All right. So that's how you'll be adding patients. Then appointments. Appointments here. You want to make an appointment. So the doctor, the hospital need to have that record for an appointment. Okay. So appointment number 11. You put the patient name. So whoever is making an appointment must register first. So you put the patient name, the gender, the doctor who is doing the appointment date, appointment time, you select here, just like that. Maybe you want him to see you at 3 p.m. like that, then you put OK, then it will be reflected here at 3 p.m. So status, maybe scheduled. Then select or enter reason. So the reason as to why you have to be you have to see the doctor on that particular date. So maybe special consultation, right? Then you save this appointment data. Okay, let me close. So that's how you'll be creating appointments. Vitals, we have the vitals here. Remember, a patient when they reach the hospital, the first thing they will be doing after registration is checking the patient's vitals. All right, that one is very, very necessary. So the patient ID, already the patient has been registered. So the ID, you put enter, then the name will be reflected here. So the temperature, you'll take the temperature, the systolic blood pressure, that's the higher one. So you'll take the systolic blood pressure, maybe 107. Diastolic blood pressure, that's the lower one. You'll take it to maybe 69. Heart rate, okay, in beats per minute. Then respiration rate, beats per minute. Oxygen saturation in percentage. Weight, all right. You'll take the weight, maybe it's weighing 1% from 4. Height, maybe the height is 265. Then pain level, maybe the pain level, this pain level is 4. Then medical history, maybe you can say cancer. So those are the patient's vitals. So you save that one, all right? You click save. The temperature, maybe you're taking the temperature 36. Then you save, okay? All right. So that's how you'll be taking the vitals of this particular uh, patient. So you can also search for an vital instance ID. Use vital instance ID like 2, then it will be captured like that. So the patient, the vitals of these patients, once you save, it will be available in this particular system. All right. Then we have the doctor's orders. Remember, once the patient has been checked in terms of vitals, he will be sent to the doctor. All right. All right. So the patient will have to see the doctor so that the doctor will be able to give further directions. So here we have the model where the doctor will give orders, right? So while we are the doctor, we will be able to check the patient ID. So this is the 18th order. So the doctor will come here and select the patient ID. Just type the patient ID. If it is 100, then you enter. Then the details, including the patient vitals and the medical history, will be displayed. Let's say we are now putting the we are doing the testing and the pathology radiology. So coming here, we select pathology. Okay. All right. Then we put the service ID. And remember, service ID you simply select from here. So we can select, and then you can see the service ID and then the test, the cost. Technologists will be able to reflect here, right? Then you save. So once you save, all those details will be captured and we'll have it in the record, right? So here we have already a list of orders which already done by the doctor. So these are orders, right? So once you've placed your order, so the order will either go to pathologist or rather laboratory or radiology department, right? So we close that one. So here we have pathology or radiology. So let's say now the radiologists or pathologists have received that particular notification. So we'll have to do the test. So this is the 16th result ID. So here the lab or clinical laboratories will come and say we now have 11th order ID. Then you say okay. You can see already once the doctor's given the orders under whichever department. So when it is pathology, then you come here, you'll see, you'll find the orders already waiting there for selection. So we select, then we put enter, then the name, the patient ID, the patient name, the doctor who is ordering that particular service, the service ID, the tests, then these are the particulars of that particular test, the normal range, the unit, and then the service cost. So then now, because this is now pathologist, let's say we have done the test, which is the ion test, and you can put the results here. So let's say it's elevated, meaning the amount of ion is elevated, maybe in the blood of that particular patient. So it can be elevated, it can be above the normal range, it can critically above the normal range. It can, so these are type of results can be normal. You can give a result of maybe high, low, whichever way or format you want to give your particular result. So the ion test maybe, let's say, low. Okay, that means the ion is low in the blood of that particular patient, right? So that is the result, or that is uh, the result for that particular test. So you save that particular result details. Okay, so you click save, then everything will be saved. So already we have various results here. You can see how there are very many. These are the already saved results. So once you forward the particular results, then it will be able to be seen by the doctor. So we go back here. So remember, it can either be pathology or radiology. So let's say it went to radiology, you can see still the same thing. So you simply select the particular order ID. When you come here, you can refresh here. When you refresh, you'll be able to see the order ID. So like 14, you just press, then you put enter. So everything is already displayed. This is the name of the patient, the ID, the doctor, the service ID, the tests. Like this one is CT scan, right? That is the test ordered by the doctor to be done on this particular patient. So for this particular test, which is CT scan, we need to give a report. So this one will go to radiology department. So the radiologist will do the CT scan or computed tomography. Okay, computed tomography scan. Then the reporting will be written here. So just put the report here. Okay, whatever the finding you are coming up with in this particular scan, you give the report here. So after giving the report, you save that particular results, imaging results. So this already, we already have various results here. Okay, so you can see we have so for example, this one you can see this is the result, a mass in the pancreas with associated dilation of the pancreatic duct. So that's an example of reported or reporting on this particular order test. So you save. So after saving that, the doctor will be able to find those ones when he will be dealing with the treatment plans. So let me now go to the treatment plan here. So under the treatment plan, remember the patient has been tested, results have been given. So the patient is back to doctor for further directions. So the treatment plan, under the treatment plan here, the doctor will be able to give possible treatment plans for that particular patient after those tests. Okay, so we will refresh here, so you'll be able to see uh, the test status. So these are the completed tests. Okay, so let's say like this patient 108 here, the test already completed. So when you select the patient, you'll be able to see all the details of the test. Okay, so like for example, you can see this patient is called Canina Lado. Patient ID is 108. This is a result, test result. The CT scan reveals a solitary enhancing mass lesion in the left frontal lobe, likely representing a neoplastic growth. the characteristics are consistent with the meningioma or glioma. All right. So that the result or the report for the CT scan. Okay. Okay. So now, because the doctor is able to see that one now, the doctor will be able to give further direction, or the doctor will give further treatment plans based on that particular result. So the doctor will be able to come here and double click here. So here you'll be able to see that the ID, the patient's 108, the name is here, the doctor name is here. The test is actually pelvic computed tomography, that is pelvic CT scan. Then the result is here. Test for pelvic CT scan reveals a solitary enhancing muscle lesion in the left frontal lobe, likely representing neoplasia. All right. So here the doctor will be able to give diagnosis, and then give the prescriptions of medicine. Okay. So the diagnosis, the doctor will be able to write the diagnosis here. Okay. Then the medicine ID, the doctor will be able to select here. Just double click. Then a list of medicines will come. So the doctor will be able to prescribe. So for example, let me say prescribing that one. So double clicks. Then the medicine ID will come. The medicine name and description and the cost per unit. Okay. And then the doctor will be able to give the dosage for that one. Maybe let's say 2. Frequency means how many times in a day, maybe 2. Then duration for how long, maybe for 8 days or maybe 10 days. Okay, so that will give the, okay, you can see already we've been given here twice 2 tablets, so twice daily for 10 days. Okay, then the advice here, you can say bed rest. So whichever advice the doctor is giving. Then patient type, maybe inpatient or outpatient. Okay, then you update. So this means you are giving prescription, okay, depending on the results that we have from the laboratories. Okay, so you may give you can prescribe one medicine or various medicines. Okay, then you update, you click update here. So when you click update, that particular prescription will be saved. All right. So when you click update, for example, let's say update, so you can say, are you fully satisfied with this prescription? When you say yes, then that prescription will be saved for this particular patient. When you say yes, you can see we already saved. You can even you can say prescription saved successfully. Okay, so you can give another one if you like. So you can the diagnosis can remain, but you may give various medicines towards that particular diagnosis. So you can add another one. So you just add, okay. Then dosage, you can say, let me say 1. It's a drug, you can say 1, maybe twice. And then duration, you can say for 10 days. So once you've completed that, you will see that down here, this one will be displayed. So 1 times 2 daily for 10 days. Then you give advice, okay. Then the patient type still remain the same one for this prescription. Then you update, okay. That's how you'll be doing that one. All right. So that's how the doctor will be giving prescription. So for this particular patient, let me say, what about if you have this patient here? And see, this patient, the test is, we are testing, the result is normal, and we are told total test has shown normal for Shema-Diola. So for this one, if it's normal, then there's no need of prescribing any medicine towards that one, because actually it's normal after all. So the doctor will do what is necessary, right? What about this patient here, Leila Mercuri? So this one is for HIV antibody test, and Actually, you've seen here it is positive. The test has come out to be positive. So the doctor will give the diagnosis here and prescribe medicines as required, okay? And then update or save that particular prescription for that particular patient. So remember, we may have other treatment plans. For example, for this patient here, okay, there may be there may be further treatment plans that can be done, okay, maybe surgeries and so on. So instead of prescribing medicines here, we can go to other treatment plans. So here we'll have the details of the patient still displayed here. So we'll have the treatment type. For example, if the patient is to undergo some surgeries, you just select the, so that is treatment plan for that particular patient. So that is for other treatment plans like surgeries, blood transfusions, and so on and so forth. Okay, so patients can be given other treatment plans apart from just prescribing medicines and putting them under medications. We can also do other treatment plans like surgeries, okay, blood transfusions, and so on and so forth. So depending on the tests that we have, okay. So that's how the doctor will do treatment plans, okay. All right. So those are treatment plans. Then admissions here, the patient may be admitted as inpatient. So this is where we do admission. When the doctor sees that it's deserving that the patient needs to be admitted, okay, then this is where the doctor will be able to do the admission. So just put the patient ID, for example, 100, then you put enter, the name will display here. Ward ID, just put here, you select the ward ID because we already have the wards in the data. So you just put the ward name, if it is ward 4, intensive care unit, if it is ward 1, pediatrics, if it is ward 2, medical, ward 3, surgical. For example, you can put ward 3, surgical ward, okay. So the ward ID, the ward name, the ward type will be displayed here. Then the room category, for example, you may want the patient to be in just a normal hospital bed or a private room and so on. So you'll select the room types here, room category here. Remember the room category already, we have them in the setting. So we have general ward room. This is where we share room in a hall, for example. Then the semi-private room for 2 or more beds, private room, single occupancy, deluxe room. Okay, deluxe room is for luxurious, self-contained rooms. So suite room, self-contained room with that is for post-operative recovery. So there are various types of rooms and their cost. So you select whichever room you want the patient to. Let me say general ward room, which is just shared room. So general ward room, already the cost is here. And then the room number, we don't have room number because it's just a hall or where people are just sharing one hall, different beds, okay? So we use ward bed, all right? Then the bed number, for that particular case, the bed number you will just select here. Just select the bed numbers. So you can select bed number 26. Period for staying in that particular bed, and say maybe 10 days. Okay, so these are admission details for that particular patient. Okay, then you save the admission. Are you fully satisfied with this admission details? Just say yes, then the data will have been saved. Okay, so that's how you'll be saving admission details, or rather admitting a patient who is supposed to be inpatient. Okay, you can see the one we've just added is here, Leila Makori. When you select it, all the details will be displayed on the controls. Okay, so that's how you will admit patient. So we close, we have admitted those ones. So we also have pharmacy module. this is where you'll be adding all the medicines. So as at now we have 235 medicines. The next one is supposed to be 236. Okay, so you put the medicine description here, the category under which the medicine falls. So is it under tablets or capsules, inhaler, oral liquids, antidiarrheal injections, dermatologicals, disinfectants and antiseptics, okay, theater medicines, vaccines, family planning, commodities, anti-malarial, and so on and so forth. So those are categories under which this medicine falls. So you put the category, okay, then the unit price, you put the unit price here, then the stock quantity for that particular medicine, the stock, then the reorder point, maybe 10, the point at which when we reach, then you're supposed to reorder. Then the manufacture date you put here, then the expiry date you put there, all right? So that is how you will enter, then you save. So these are already entered data. When you select, already you can see we are displaying them on the controls, so you can see. So these are already medicines that we have in our system. So those are the real medicine that we have according to KEMSA, right? So those are medicines and their expiry dates. You'll also set their expiry dates. So remember, you can update any of them. You can delete any of them, okay? You can update and you can delete, right? So that's how you'll be saving data for any particular medicine that you want to put into your system, okay? Remember, you will be adding medicine, you will also be dispensing and also adding stock. So dispensing, when the nurse or whoever responsible for the treatment plans for those particular patients, they will come for the medicine, okay? For example, for the inpatient, the patient will not be able to access the pharmacy. So it is the nurses who will be coming for the medicine that's supposed to be used by the patients. So they will come. So when they come, you will be able to dispense, as the pharmacist, you will dispense the medicine depending on the doctor's prescriptions, okay? So let me just demonstrate how that will be done. So you just come to dispense. So in this dispense form, you can see it here. We will put the patient ID, for example, 100. So when you put 100, the details will just come automatically. Patient name, the doctor's name, then the department, OPD or IPD. So for OPD, okay, they may come for the medicine themselves, or the nurses can take the medicine, all right? So now we will have, these are the prescriptions. So a patient may have more than one prescription, okay? So you click this one, it will display the first prescription. You can see when you click that one, you can see we have not even the first, but all the prescriptions will be displayed. So you can see this one is a prescription, this one is another one, this one is another one, this one is another one. So now the pharmacist will now prescribe or will now dispense this medicine depending on this prescription. So for this first one, we will use this first dot or option. When you have the second option, then you are in this second prescription. The third option, you are on the third prescription. The fourth option, you are on the last prescription for this particular patient. So let's say the first one we want to dispense. So you just click on this first one. That means on this first prescription, then you say dispense. So you can see details for that particular prescription is already displayed. You can see name of the medicine, potassium chloride injection 50%, 10 ml. Then to dispense, number to dispense is 20, because that's the number the doctor prescribed. You can see in this particular detail here, you can see 1 times 2 for 10 days, that is 20. So number to dispense for that medicine is 20. So when you click OK, that means you have already dispensed 20, and this particular drug or this particular medicine will reduce in number by 20, okay? Because it is balancing the stock that we have. So for this particular medicine, it reduces in number by 20, okay? Then you put OK. When you put OK like this, that means now that medicine has already been dispensed for the same patient. Do you want to make a refill? So unless we want to make a refill, we don't need to prescribe the same medicine for the same patient twice, okay? Unless it's a refill. So like this one, I think in the system here, this medicine already prescribed for this particular patient. So if you want to make a refill, then we just say okay, yes, let it be a refill. Just put okay. But if you don't want it to be a refill, just put no. Then that one will be cancelled like that. So in the system, I think I already prescribed that one for that patient. So when you put second one, then you are on this one, then you dispense. Okay. So unless it has not been dispensed, so you can see 60 here to mean 60 units. So you put okay. Okay, this one, even this one was already dispensed. Okay. So for this demonstration, I think they have been dispensed. Okay. So if say, okay, let me just make a refill so you can see refill completed successfully. So it means the drug here has been reduced by 24 and already data saved successfully. Okay, you can see that. So that's how the pharmacist will be dispensing the medicine depending on the doctor's prescriptions. So when you select another patient, maybe 102, you can see for 102, we have only one prescription here. So you can see this form is also reducing in size depending on the number of prescription in place. So when you select 102, the system is able to extract the prescription for the patient here. So it's only one prescription, it's only one, you can see it's only one, this one only. So you can dispense, okay, if it's not dispensed, okay, that means already okay. I think the system already, we are already done dispensing for that one, but if you want to make a refill, just say yes. Okay, okay. So another patient, you can just select maybe 104. No prescription data found for that. So this patient, there's no data for prescription. You can see it's blank. So it depends with the data that we have in the system. What about this one? Okay, this one has got one prescription. Then you can dispense. Okay, so for this one, just dispense using this one. Okay, this one I think already data system. So this is the first dispensing of that. So we've dispensed that drug to reduce in number. Okay, so that's how you will dispense medicine depending on the prescriptions. So add stock, here the pharmacist will be able to add stock. You just put the medicine name here. You can select them from here. Then it will give you the current stock. After current stock is the running number or the running stock, or rather the value that we have at that particular time. Remember, when we are dispensing this medicine, the number will be reducing instantly. So this is the number that we have. So when you add a quantity, for example, maybe 50, you simply add, then the number of units will increase by that 50. The stock quantity will increase by that 50. Okay, so that's how you'll be adding stock whenever you do purchase for that particular drug. So the pharmacist will be able to dispense, and also will be able to add stock. Okay, so I think we have that one is now through with that one. Then we have cashier. Cashier will do billing receipting and so on. So here the cashier will select the patient and then we will be able to get the bill for that particular patient. So let's say we are getting the bill for that particular patient. So already we are printing it. Okay, then we can save. So it's printing the bill for that particular patient. Bill printed successfully. So when you check here, see we have the bill. So you can see a very good report, very good bill here. Okay, you can see this is the bill for that particular patient. So this is the name of the hospital, address, phone numbers, email, then medical bill. So you can see the bill number is here, the patient registration number is here, patient admission number, the name, date. Okay, so all these are services which have been offered for that particular patient, and therefore in the bill they have been captured and their respective costs. Okay, so this is the bill. You can see how very nice it is. Okay, so that's the bill. So after generating the bill, the patient is supposed to be paying and then getting the receipt. So payment, so remember we have seen the bill. See the change, the system is given as the change. So the pay type, let's say maybe check, the pay type check. So you can say okay. So now it's printing the bill, it's printing the receipt. So the receipt, okay, that is the receipt we are saving there. So we already have the receipt printed successfully. So you can look at the receipt. So this is the receipt. This one here we just printed it. So you can see the receipt is here. Very nice. That's very nice, indicating the change down here, the subtotal, the payment, and then the change here. And all these are particulars of that particular receipt. Okay. So you can see we can generate receipt. So the bill and then the receipt. Okay. Very nice. So that is how the cashier will generate the receipts and also generate the bills. Okay, so the cashier will also do other things. I'll explain later. So that is the work of the cashier. Then the referrals here, this is a model where you will be entering the data for referrals. So maybe a patient is taken to another specialist, another hospital, so you'll be able to do referrals. So here we put patient ID like that, press enter, referred by maybe the doctor, then referred to whichever hospital is going to, then referral date you just select, then reason maybe for CT scan, for example referral notes, you put some notes here on the referral. All right, ambulance, true or false, you want to use ambulance. Okay, so ambulance cost, you will put the cost here depending on the distance and other things. Okay, status may be approved, then you save. So these are referral data, then you save. Okay, so you can see down here we have already entered data. When you select it, the details will be displayed everywhere. So you can see this one is one referral data. Okay, only one referral data. So you can add some referral data depending on who is getting referred to where. Okay, so that's referral module. Then we have reviews. Remember, the doctor will be doing reviews for patients maybe every day, and the nurses will also be checking on the patients. So this are review module. This is where you'll be recording the review data. So you want to record data, you will just select the name of the patient. Okay, select enter. So all the patient's entry vitals and the medical history will be displayed here. The doctor name you select here. The review date, you select a date there. Then you may want to check on the vitals when you are checking on the patient, you record the vitals again. Okay, just record the vitals. You may want to record them so that you monitor the changes on this particular vitals. Okay, changes on blood pressure, changes on temperature, and so on and so forth. So you record these ones during reviews. Symptoms that may that may occur. Okay, you also put those ones during review. Okay, progress notes, maybe you want to say progressing well, and so on and so forth. So medical changes, if you want to maybe change medication, maybe treatment plans adjustments, you can put those ones here depending on what how you evaluate your patient. According to your own evaluation, you'll be able to say the patient is doing well or the patient is not doing well. Let me change the treatment plans. Let me change the medications and so on and so forth. So even medication, you can change here by indicating that we have changed some medications. Okay, treatment plans, you may say adjusted a little bit depending on how the patient is uh, responding to those treatment plans. Okay, recommendations, you can say some recommendations there, whatever you are recommending. Next follow-up, maybe you will come for the next review on that particular date. So here you put review data. Okay, review data, you check on the patient maybe daily, maybe every morning, then you record the review data here, then you save. So this review data is very helpful for making any necessary changes. All right, so these are already existing data, we have them here. You can always update them, and you can delete whichever you want to delete. Okay, so that's how you'll be managing the reviews. This data is very necessary because they will be part of the medical record for that particular patient, and reviews you do regularly. Okay, and you record the data here. So then we also have discharge summary. Discharge summary, this is where you'll be summarizing everything regarding the stay of this particular patient in that particular hospital before the patient's released or discharged from your facility. All right, so you put the patient's ID here, patient ID 1, and then you press enter. All the details will be actually displayed here. You can see the doctor, the patient name, the admission date already here, the diagnosis is already here, the laboratory or radiology data is also here, the medication, all the medication that were given is also here. So what you only need to do is to put the procedures, add the procedures which were done, if at all they were there. You can put all those ones. Then discharge date also here, the dates on which you want to do the discharge, put the date there. The procedures which was done, you also put here. If it's not there, you can say not available. Condition is stable. Reason for discharge, you can select here, maybe medical stability. Summary of stay, responded well to medication. Instructions, continue with medication. Okay, maybe bed rest. Okay, follow-up dates, maybe you want to make a follow-up after some time, put the follow-up date there. Destination, maybe home. Then you save. So this discharge summary. So when you save this one here, remember when you save, this has a record already created for the patient. So it means this patient was already discharged. So I think as a matter of demonstration, I think the patient already, we have the discharge summary detail already, so it cannot discharge twice. So you can select another patient, let's say 102. Okay, all these are details. So discharge dates, you select here. Condition, very stable. Reason, you can select the reason why you are discharging. Treatment completion. Summary of stay, maybe you can put some summary there. Instruction, also put there. Follow up date, you can make a put a follow up date there. Reason, or okay, destination home. Then you see now discharge data entered successfully. Okay, so that means we have actually entered the discharge. We have entered the discharge summary data. So next is printing. You can see this automatic. So we need to print that particular discharge summary. So let me say discharge summary. The name for, we can name that particular file like that. So it's printing discharge summary printed successfully. Okay. So let me check on it. So when you check on it, you will see. Okay, it's here. So the discharge summary will depend on the overall stay of that particular patient in that particular hospital, and all the services and all the procedures and so on which were done for the patient. So the summary is here. So it depends. So you can see this is the summary. This is a summary for that particular patient. Okay. Every detail is here. Patient details is here. Diagnosis, laboratory, radiology results is here. Procedures, reason for discharge, instructions, discharge date, medication that were given, condition stable, summary, full update, everything is there. So that is the discharge summary. Okay. You can also put the patient ID here. Then you just search like that. Then you can print the discharge summary like that. So you can see. Let me rename it like that. So that's the patient. We are just maybe selecting and printing summary. Okay. When we check on the discharge summary for this particular patient, okay, it's here. So you can see this one here. This is the summary. So that's the one for that patient we just selected. So you can see all these details. Okay, that is for that particular patient. So that's how you'll be printing this summary for patients. Okay, let us close that one. So then we have birth notifications. This one you'll be giving birth notifications to the patient. For example, if a birth has happened in your hospital, then you'll be able to give birth notifications, and you'll be able to record that particular birth. So you record the birth, and then the notification will follow. So the name of the baby, the first name of the baby you put there. Okay. Then you put a middle name. Then you put father's name. Then you put day of birth, maybe 3rd of that month, February. Sex, maybe female. Let me say female or male. Type of birth, maybe single. Nature of birth, maybe born alive. Place of birth, you put place of birth, sub-county. Okay. Patient. Okay, that one is okay. Then mother's name, father's name. So now, then issued to, the birth notification will be issued to maybe Laila Makori. ID number, maybe, okay, issued date. Let's say this is the issued date. Okay, like that. Then now you can save that particular birth detail or birth notification detail. So when you save, it will actually save that one. So now birth data entered successfully, so you just say okay. So what follows now? Printing the notification. So you can say, so this notification here is for the birth of this particular child. So we are printing a birth notification printed successfully. So I wanted to see the notification here. So the other one, okay. So when you look at this one, we've searched and printed the birth notification here, and you can see the name for that child, the date of birth here, day and month, sex, male, type of birth, single, nature of birth, born alive, place of birth, Voi, name of mother, Leila Makori Ulo, notification issued to Leila Makori, ID number, that one, date, that one. You can see this one is now a very nice birth notification, which you can go with us just as stipulated down here. To obtain a birth certificate, present this notification to the sub-county register of births where this birth occurred, okay? So that's the notification for that particular case. So you can see that's very nice, okay? So non-pharmaceuticals module here, we are adding the non-pharmaceutical items. Just add the items. Already we have 256. The one we want to add is 257. So we put the item name here, okay? Then the category, you select here, whether it is in surgical dressings, linen category, orthopedic, and so on. These are categories under which those items belong. So you just put the category there, unit price, okay, quantity, then reorder point, okay, then you save, okay. So these are already saved non-pharmaceutical items. You can see how many there are. There are very many. There are very many. So all those courtesy of KEMSA, we have them in this particular system. So again, you can search here. Just put the item ID, then search. It will be displayed like that. Then you can update. Maybe you want to update something, the name or category or reorder point, stock quantity. Just now update. Okay, you change. After changing that particular detail, then you click update here. You can as well delete here. So that's how you'll be managing your pharmaceutical non-pharmaceutical items. So here again, you can dispense, you can add stock. When a nurse or a doctor wants to use maybe bandages, cotton crepe, and so on, for example, you just come to dispense, then item name, you select here the item name to be dispensed. Just select from there. You can see how there are many, okay. Maybe solutions for blood category, already the category is given here, issued to whoever is receiving them. You put the name here. Department, you select the department, maybe, then you put the quantity issued there, the date issued, you put there, then you submit. So these are details for issuance of non-pharmaceutical items. So because the quantity is here, this one is going to be to reduce. Is going to the current stock is going to reduce by this particular amount which is issued for this particular item, okay. So it's balancing the stock. So that's how you'll be dispensing the non-pharmaceutical items, okay. Then you can also add stock. Whenever you increase the stock, you simply add the stock from this point. The current stock is given here, then what you are adding you also put down here, then you say, then you click add. When you click add, of course the stock quantity will be updated successfully, okay. So that's how you'll be updating, and that's how you'll be dispensing this particular non-pharmaceutical item. Because in the hospital, we don't only have to have stock of medicines only, we also have other materials which are very necessary in the, so we need to have all the non-pharmaceutical that are required in the hospital, and here we have them in this particular system. Already we have the ones which are required in the hospital. Here you can see them, there are very many. Okay, there are very many. Okay, okay. So you can update as well. You can update the stock quantity, the unit price, and so on. You can update any detail on this particular item. Okay, so those are non-pharmaceuticals. Okay, then we have also blood bank. Blood bank, remember, sometimes the sick patients may need blood, and therefore we need to manage or have a blood bank where we're managing our blood samples from different donors. All right, so in the blood bank we'll have the donors, we'll have the donation taking place, and also we have the blood bank itself. So first of all, there has to be registration of donors. Those people who will be donating blood, they are registered first before they donate. Then after registration, we go to donation. So then you can donate. After donation, then we can go to uh, dispensing of those particular samples, or rather sachets of blood. All right. So here we first of all register the donors. So donor name, just put the donor name here. The blood type will be maybe A plus. We have 8 blood types. Okay, 1, 2, 3, 4, 5, 6, 7, 8. So they're normally 8. So blood type A plus. Last donation date. This patient or this donor donated last in 2017. This is the date he donated last. Health status, and okay, just contact number. Okay, email address. Okay, so those are just donor details. Then physical address, maybe. Okay, then you save that. That's the donor details for that particular donor. Are you fully satisfied with the blood donor details? You say yes. So when you say yes, you can see you will have saved that particular donor details. So donor information entered successfully. So when you look at the data, our database here, you will see the list of data we have in that donor database. You can see Kendo. This is the last one we've just entered just right now. So now that's how you'll be adding the details of the donors. Okay. So now in this particular module, you will also have donation. Remember, we've added donors. So when you go to donation now, you simply select the donor ID. So if the donor ID is number 4, for example, you can see Kendo, then the blood type is already displayed. So the details will be displayed automatically like that. So let's say storage location. Okay, fridge 1. Okay, fridge 1. Then donation date is donating on this date. Expiry date, let's say donation date. I want to put donation date to be this one, then expiry date to be that. Okay, because blood mostly they expire within a month like this. Status, so we can say available. So this one is blood donation detail. Okay, blood donation detail. So we are putting the we have blood ID here, the donor ID, also the name of the donor, the blood type, and then the storage where it's stored, then the dates, donation date and the expiry date, and then the status now available, which means this blood is available, the paint is available for use, so we can submit this particular data. Okay, so we have submitted that. All right, so now that blood donation data is saved successfully. Okay, so we have successfully saved that donation data. So that person has donated blood. Okay, so it means that blood donated is now very available there for use. So now when it comes to dispensing, maybe a patient requests blood somewhere in the hospital. Now we'll come to this module for blood dispensing. So blood ID, we can always have blood ID here. So like the blood ID, the one we just dispensed, we've just donated here, blood ID for blood type A plus. Then the patient needing that particular blood of this type, maybe this patient is patient 102, Shema Diola. The name was already appeared here. Dispense date, maybe let's say this date. The units maybe one pint, okay. Issued by, so here the one in charge of the blood bank, let's say Susan Maloba. Then you submit, okay. Okay, again down here when you look at this, so dispensing data says successfully. So you can just say okay. So you can see we have dispensed blood, because this one is the one we had, and already we've dispensed it as you saw the other time. We were saving data for dispensing, and this one we dispense this one here, and you can see the status already changed to dispense. Okay, so immediately you dispense a blood, the status changes to dispensed, unless it is expired. Okay, the status will always change from available to dispensed if it is dispensed. Okay, so that's how we dispense the blood. Okay, then we also have a blood bank. So here you will be checking the how is your different types of bloods in your blood bank. Okay, so these are the types of blood types, you can see them here. Donated, it will give you the data donated to the minimum pins you are supposed to be having for each particular blood type in your blood bank. Okay, so that you will be able to know the stock. So like right now you can see we have red color here, which means we are supposed to be looking for those types of bloods. Our blood bank is very uh, it's in a bad position. We should be able to look for the blood pins for this particular types of blood. Okay, so you set the minimum for your stock, so that if the stock goes beyond below that particular minimum, then we are supposed to be ordering for more. Okay, so here it will give you donated, total A plus donated, dispense, and then the remaining stock vis-a-vis or against the minimum that is required. Okay, so here you can also set the minimum. Just put the minimum that you need here. You put the minimums for each type blood. Just put the minimum, then you save. Then you save. So after setting the minimum here, so the system will be using that one to give the stock, or to give to give a notification, so that you are able to know when to add the stock for those particular blood types. Okay, then you click set here, just to set the minimum required for your blood bank. Okay, for each blood type. So that's how you'll be managing blood bank. You'll be adding the donors, you'll be doing donations. Okay, then you'll be dispensing, and when you are dispensing, the system will be balancing the stock against, it will be balancing your stock for what we have in under donations and what we have as dispensed. Then we'll be able to know the stock. Okay, it will be balancing automatically. So that's the blood bank module. Then we have reports here. Under reports here, the system will generate very many types of reports. You can see non-pharmaceuticals. You want to know surgical dressings. Surgical dressings, which ones do we have under that one? So under surgical dressings, you can see the report here. It has generated all the non-pharmaceuticals under that particular categories. So you'll be able to tell, okay, be able to see each non-pharmaceuticals under surgical dressings. Okay, then we also have you can look at all the categories. We can't look at all of them, but the system will generate for you the reports for all those categories under non-pharmaceuticals. You can see here we have only one item under linen category of non-pharmaceuticals. You can have catheters, for example. Let me see the non-pharmaceuticals under catheters. So the system will just generate for you, and you'll be able to see clearly here. We have all these non-pharmaceuticals under catheters. You can see category here, catheters. So all these are under catheters. You can see. So the system will generate for you the non-pharmaceuticals depending on the categories. So we can't look at all of them because there are many. You can see there are very many categories. Okay, there are many categories. Sorry, I've regenerated this one again. So let us look at medical list also. Medical lists. Medical lists here, we can select category injections. You can see which medicines are falling under injections so that you will be able to make decisions appropriately. So you can see this one here is a list of medicine, but under injections, okay? Under injections, and there are very many medicines under injections given there. What about medicine under tablets and capsules? They will be given here. So you can see we have them here. Also, this one is under tablets and capsules. There are very many as well. You can see very many, but under capsules. So again, here the categories are quite a number. You want to know under dermatologicals. So because the categories are many, again, we can't generate all of them. So this one's under dermatologicals, okay, as you can see. So the categories are many. I've just demonstrated for that one. There are very many. We can generate for all of them, but due to time. Then income from OPD or IPD. Let's see the income from OPD, general income. So we generate, then it will give you the amount received from OPD or outpatient. So you can see the amount is being given up here. Okay, so category is OPD. So that's for OPD. How much have been received under OPD, it will give you up there. So again, you can look at how much have been received under IPD, just generate. So the inpatient department, we are receiving how much money from that one. So this one giving up there depending on what we have as data in our system. Then also depending on pay type, OPD cash, OPD cash. Let us see. OPD cash, that is what we have. OPD cash, that's the that's the report. OPD cash, okay, the amount received and by cash and under OPD. So you can see OPD, another maybe through check, OPD check. It will generate for you. Okay, only one case. Okay, under OPD check you can see check, and this is the amount received under that one. So depending on the pay type and category, you can easily generate the report. Then the appointment status, you can see schedules. You can easily tell which appointments are under schedules, which appointments have been completed, which appointments are still pending, and so on and so forth. So you can see like this one, appointments, scheduled appointments, okay, scheduled ones. You can know the appointments which are under schedule. Then you can also know which appointments are cancelled, completed, and so on. Let me see completed. So there you can generate appointments reports based on the status. Okay, these are appointments which are completed already. So you can see, and then you can print those reports if you like. Those are PDF. Okay, what about blood bank type status report? So you want to know blood type A plus status status, maybe available. You want to know this blood type A plus and this status available. You want to know the reports on that, how much available for A plus. So generate. So there's none. Okay, for blood type A plus there is none available in the blood bank. So you can see, you will easily know which one's available. The dispense one, let me say the dispense A plus dispensed, we want to know this blood type A plus under dispensed. Okay, so you can see dispensed is only one blood ID. Okay, dispensed A plus, which has been dispensed for that one only. So you can see. What about the other one? Maybe B plus. What about B plus dispensed? So you can generate quite a number of reports under that one. Okay, so again here, oh, none, for that one, none. You can generate for all of them. You can generate for all of them, and you can check whichever. Let me say expired. Expired, maybe let me check B plus if there is expired one. Okay, none. So there you can generate quite a number of reports. Dispensed medicine, you can see IPD dispensed. You want to know which medicines have been dispensed under IPD. It will generate for you that one. Okay, you can see under IPD, these are medicines dispensed. You can view that one. Okay, then also even under OPD, you can also you see which medicines have been dispensed under that one. So you can also tell that one. You can see those are medicines which have been dispensed under OPD. You can see these are the medicines, OPD category. Okay. Then you can also check bill to be offset by, these are insurance covered, maybe IPD, this insurance cover NHIF, we can generate to see. Okay, here we NHF, no, 0. Then what about if you put this one? So depending on the data that we have, it will always generate for you. So for this one, we have only that one case where we have our own going to offset the bill. Okay, so that's how you can check whichever, if we have insurance cover, can check both IPD or OPD, which one is going to offset the bill. Okay, where the claim is going to be attached. So other treatment plans, so you can select the treatment plans here and then you see the report. Okay, the treatment plans are here. You can always check the report. So like for example, this one, generate to see if there's a report on that one. Okay, like this one, there's just one case where we have brain tumor surgery for that person only. So you, for all those treatment plans, you can always generate reports on them. So births and their natures. So maybe born alive, babies born alive in your hospital, you will be able to see the births and their natures. All those ones at the fingertips. You can see this one, this detailed reports here. Okay, these are births and their natures. Born alive, born dead. You can also review that one. Okay, patient stay status. So you can, for example, you can have deceased. You don't want to know how many patients have ended up dying in hospitals. Okay, you can generate that one. Okay, one person has died in our facility. So okay, can also check those who have been discharged properly and went home. All those reports you can view. So you can see this system can generate quite a number of reports, as you can see. So these are discharged patients, okay, and these are the insurance. So okay, so you can also check radiology and pathology, select status. So maybe completed, you want to know completed pathology tests. So tests which have been completed, maybe awaiting the doctor's treatment plans. So these have been completed. So you can see the completed radiology, imaging reports, and also laboratory test pathology. Okay, you can also look at in progress, maybe in progress under radiology. Just select like that, then you generate. So reports, you can see there are very many, and we can't generate it. We can't actually generate all of them because of time. So these are ones which are still in progress. Okay, under radiology. Okay, then what about referrals? You can select here to see the report on referrals. You can click that and it gives you a report on referrals. So you can see we only have one referral here, only one referral here which has been completed. Okay, and you can always print that those reports using this button here. Okay, so those are reports. Okay, the next module is settings. Here you will be doing various types of settings. You register users, you put the hospital details, room categories, service offered, insurance, treatment types, factory settings. Okay, so like register users, this way you'll be registering the users, because this particular system is multi-user system. It means there are roles that we play in this particular system. When you are assigned the role of admin, you'll be able to access all parts of the system. When you assign the role of a doctor, you'll be able to access doctor-related functions. When you are discharged with the role of receptionist, then you'll be able to access receptionist-related functions. Nurse, then you'll be given nurse-related functions, and so on and so forth. So this system, we need to enter users and then give them their roles, and then also give them passwords and usernames. For example, let me say this one is a new user, Jared Kolala, then email, maybe jared@gmail.com, then maybe username, Jared, user type, maybe Jared user types, we can say Jared is a nurse. Okay, password maybe Jared 1234. We have submit, you can see user added successfully, so you can say okay, so we've added that particular user. Okay, so now we go to the 15th user, so which means the other one was 14. If we search, you can see the details for that particular user is already here. So we are going to give Jared the password and so on, which can be changed sometimes if he likes. So you can also update this user if you like. You can also delete the user. That's how you'll be adding the user. Okay, so remember those users, you as admin, you'll be giving them their passwords so that they will be able to access the system. So hospital details here, you'll be giving, or you'll be setting the name of the hospitals. You just change all these details, then you update valid password access. So you need to put the password here. Okay, then you update the hospital information entered successfully. Next is uploading the hospital logo. So when you put OK, then what follows is uploading the logo. Okay, so the logo, let me put this one here. Logo. So this one here. So hostel, like for example, we can put this one. Okay, you can even put that one. So logo uploaded successfully. Next is country name. So you can also include your country name. For example, you can say Cameroon. Okay, okay, Cameroon. Okay, so country name. So we are through with that one. Okay, that's how you'll be setting your hostel details. Room categories here, you'll be adding the categories, different categories of rooms in your hostel. Okay, category name. You just put the category name. You describe, then cost per night. Okay, so that's where you'll be having your room categories. You can also update. Maybe you want to update. Simply select. Then this one is a room category. Post anesthesia care unit for post-operative recovery. Cost is 1,000. You can change this one if you like. Then you update. Okay. So that's where you will be adding services. So services, like now we have 139 services. Like when you want 138, check. 137, check. Service ID not found. Oh, 137, 137. You check. So all the services are here. 100, check. So all the services and their cost are here. Okay, you can add them here. The services that you are providing, all the tests in the lab, all the tests in the all the radiological insurance also you add from here. And then treatment types also you add from here. Then factory setting, here you can delete every data under all the modules. Okay, so that's where you do the settings. Then here we have about, here we have help section. Okay, so that's all about the system. Now I want to demonstrate how you will be able to log in some matter of user level as a matter of multi-user level access. So let me log out. Let me log out first. So here we log out. So this is the login form. So now I want to log in as a doctor. So we put Kim there. Kim 1234. So welcome to the homepage. Enter your email to log into your dashboard. So I want to put my email kim@gmail.com. So now when I submit that, welcome doctor, you have access to doctor related functions. So when I put OK, you are able to see that the dashboard here is now very slim. And now up here, when you check up here, welcome Peter Kim, doctor. This is the role. So my role in the system, being a doctor now, able to access these particular functionalities, only able to access these particular modules. As you can see, I can admit patients, I can do appointments, can take patient vitals, I can do doctor's orders, treatment plans, admissions, okay, reviews, discharge summary, birth notifications, referrals, and all this in the admin's dashboard. We already done all those. You don't need to do that again. So you can see appointments here. When you want to take patient vitals there, okay. When you want to look at doctor's orders, that one we have looked at that. Treatment plans, okay. That one we have looked at that. All those we had done, okay. Admissions, you can also admit the patients as IPD. Reviews, you can do the reviews. Okay, that those ones we are done. Discharge summary, you can write the discharge summary. Okay. Notifications. Okay, those ones I think we have done those ones. Referrals, so those ones we have looked at them. So that's the doctor's module. That's the doctor's dashboard, and you can see some of the links here which have been disabled here are not necessary for the doctor. Okay, the remaining ones like this one here, those are the ones which are necessary for the doctor. So that they are actually activated, they are working, those links are working, but the ones which are not working, the ones which have been disabled, are not necessary for the doctor, right? So we close this one. So I want us to again log out, then we will be able to log in as a nurse. Okay, so let me log out once again. We log out, want to log in as a nurse. So Mora, then we can say Mora 1 2 3 4. Okay, so that's a nurse. So Mora at gmail.com. So that's now a nurse. You can see a nurse has also a dashboard which is now slim, and you can see the links disabled here, quite a number. We only have this one: patient vitals, reviews, discharge summary, baths. Okay, so we close. So this particular dashboard for the nurse reveals that we are able to uh, register patients. You can take patients vitals. Okay, you can take patients vitals. You can also do admissions, IPD. You can take reviews. The nurse can also do back notifications and registrations, and also the set summary can be written by the nurse. Okay, so remember this system is very dynamic, depending on whoever is uh, in his or her module or dashboard. You'll be able to maneuver back to your dashboard. You can't go to the other person's dashboard. Like when you press close here, you're just going back to your dashboard. Okay, it takes you back to your dashboard. Okay, so this ones we had already looked at them. Let me go back home, and then we can log out. I want to log in as a pathologist. Okay, so now I want to log in as a pathologist. So we'll say clean, then clean 2 3 4. So this is now pathologist username. Okay, let me log in as this person here. You see if it is okay. That is it's now accepted. So now the email. Okay, so that's now a radiologist. You can see the dashboard is only having one item here, the orders from the doctor. So you come to that particular radiology dashboard, and then this is the module where you will be able to look at the orders, then carry out the test. So like now the order number 14, when you click at it, press OK. Okay, now these are the details of the order. The test is supposed to be CT scan. So under this CT scan, after doing the CT scan, you will be able to report the findings. So you write the report here, and then save that particular data. Okay, but those ones we have looked at them, so we close. So the dashboard for this radiologist here is just very slim like that. So when he presses this close button, he's able to go back to the dashboard. So that is the dashboard for radiologists. So let me again log out. We want now to log in as a cashier. Okay, cashier. So Davy 34. So when we log in as a cashier, then now we put Davy at gmail.com. Then now you can see where the cashier is only having a very slim dashboard like that. So everything is almost disabled apart from this one here, link to the cashier module. So you can also use this one. So this is the cashier module and we have looked at it. Okay, generating bills and also generating receipts and also doing some minor transaction like expenditures and so on. So this is the dashboard. So when you click close, it brings you back here. This one can also take you back and take you to the module. Okay, so let me go back home. So that's how this multi-user access concept will work with this particular system. So what about receptionist? Let me log out. Receptionist. Now receptionist here. Receptionist. Let me S. Okay, S. Then you can log in. So S at gmail.com. Okay, so that one receptionist. So for receptionist, you will only register patients when they arrive in your facility in the hospital. The receptionist will register them. So that is the only module they can access. Okay, so they register the patients. These are already registered ones. Okay, so that will be the work of the receptionist. So that is the only module they will access. Okay, what about pharmacists? So let me log out once again. Then I log in as a pharmacist. So pharmacists, Nico, 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 Nico 1234. So that's I'm logging in as a pharmacist now. Nico at gmail.com. Okay, this is the module or the dashboard for the pharmacist. So up here, welcome Tyler Nicolette pharmacist. Okay, so you can see we have the pharmacy where the model for adding the medicines, dispensing and adding stock. So these are the medicines you already have in the system. You can always add the medicine, you save the details. Okay, then you can also dispense depending on what is coming from the doctor's uh, desk. You can always dispense those medicines in the prescriptions provided by the doctor to those patients. Then you can also add stock. For any medicine, you can always add stock. Okay, those ones we have looked at them when we were assessing the whole part of the system. So we can close that one. Then again, the same pharmacists can also handle non-pharmaceuticals. Okay, non-pharmaceutical items can also be handled by the pharmacist. There's no problem. So now in this model, you will be handling things which are non-pharmaceutical, like abdominal gaze swabs, absorbent material for incontinence, adhesive skin traction kits, airways, girdle, and so on and so forth. So those are non-pharmaceutical items. Can also handle them, can dispense them, can add stock, and so on. Can update, can delete. So this way managing the non-pharmaceutical items. Okay. So for the pharmacist, he has got these two models to manage. All right. Let me log out and then come back as a blood banker. So when we log out, we can log in as a blood banker. Okay. So now, okay, we are in. Okay. So now we can now log in as a blood banker. Blood banker will be managing the blood bank. Okay. Okay, you can see this the our module as blood bankers. Will be able to add the donors, those people who will be donating blood. Then we'll be able to also add the data for donation and also dispense blood wherever they are required in the hospital by the patients requiring blood transfusion and so on. So you'll be doing adding or registering donors. You'll be taking donation data, then dispensing, and then also checking on blood bank. Okay, those ones I think we looked at them. So for donation, you just come here, then you take the donor detail. Okay, for example, you can put here ID1, then the details of the donor will just come like that. Then you continue with other details, then you save. Okay, dispensing, you will be able to dispense blood. So for example, you want to dispense O positive, B negative, A positive. Okay, then you put the patient who is receiving that particular blood, then dispense date, put the dispense date like that, then the quantity, maybe 1 pint, then issued by, okay, the one who is in charge. Then you submit that data. So this blood dispensing module. Okay, so and then the blood bank, this one will give you the overall view, donated, the dispense, the stock. Then you also set the minimum for each and every blood type. Okay, so that is um, blood bank module, and that's now bring us to the end of this particular tutorial. I think I've talked about everything. Let's meet next time, and may God bless you. Thank you.